Okay, there we go.
Okay. Good morning, everybody. Thank you for being here. It's 11:33 a.m. on March 16th. We'll officially call the Governor's Child Foster Care Advisory Commission call to order. And today we're going to be a little short on commissioners. As you know, we only are plus one for quorum. And so Judge Chico has something that the court's requiring her to do today, and then Malik is out sick. So either way, we're going to be at least one short of quorum. The only business item we had on the agenda today, if you can see it, is the approval of the February minutes. So we'll move that to next month. And then today we're going to have two guest speakers. First, we're going to have Rolanda Garcia, who's going to give us a little update on the budget. And I understand that she's on a bit of a time constraint, so we're going to move her up. And if we do an icebreaker, we'll kind of bump that back. And then towards the end of it, Rachel with the governor's office should be joining us to share a little bit with us about the end of the 2026 legislative session and some of the bills that they want to share with us. So welcome everybody and welcome Rolando. We'll go ahead and hand it over to you now. Oh, and before we get started, would anybody be willing to take notes?
Um, I need just a second. I need to call the person that's helping. I don't think I told her that we were starting early. The person's going to help me with the PowerPoint. So let me just do that real quickly.
In
Okay.
that case, in that case, Ellen, do you want to go ahead and just lead us in an icebreaker till
Sure.
Rolanda's ready?
Yeah. Why don't we do a name and just something that you're grateful for today, and we'll do that and then just pop it to somebody else, okay? And I'll start. I'm Ellen Bell, and I've been the coordinator of the commission, and I am very grateful for family. And I will pop it over to Casey.
Yeah, good morning, everybody. Casey Dreer, chair of this commission. I am grateful. Well, I'm also grateful for family, but I'm going to say friends this time because I had a pretty difficult weekend, and some of my friends had a pretty difficult weekend losing a dog. I had just recently lost a dog, and so I just love how communities and friends and family can come together to support each other in times of crisis and times of need. And don't know what I would do without friends and family. So I'm the same. I'll call on Sarah Powers. Welcome.
Hi. So yeah, I'm Sarah Powers. I'm a pediatrician and a prospective member of this committee, kind of pending approval from the governor. And today I am grateful for health, because I am recovering from a upper respiratory infection, as is the rest of my family, and I'm glad we're all getting better and that is improving. And I will call on, I guess, Alexis.
Good. Good morning, everyone. My name is Alexis Amarelli. I am currently serving Oregon as the foster care ombudsman with the Governor's Advocacy Office. I am a guest in this space. I'm very grateful to be here. I'm going to be taking notes, and I hope I can't remember what the template looks like, so I'm just going to go for it. Probably going to do too much, but and something I'm grateful for. I'm in Southern Oregon, so I'm right outside of Ashland, Medford area, and it's going to be almost 80 degrees here today. So I'm very, very excited. My backyard is starting to bloom, and I'm just really loving the weather change. So, who has not gone yet? I'm so sorry. Donna, pass it to Donna.
You're muted. Oh,
Yeah, thank you. I clearly do not have the capabilities to go from Teams to Zoom. Hi everyone. I'm Donna Haney. I use she, her pronouns. I'm the assistant manager in our foster care program for ODHS Child Welfare, also a guest in this space. And I am thankful for a lot of things. Today, I'm going to say that I am just thankful for um, my life and the comfort I have, and just being able to wake up and do work that I think is important, and just exist in a space amongst a lot of chaos. And Jesse, did you go?
no, yeah, thank you. So my name is Jesse Powell, he, him pronouns. And I am grateful for my heart posture for today. Not every day I'm able to sit in this space and be present and grateful. So yeah. Um, I will go with Alicia. Good morning.
Good morning. I'm Alicia Richard. I work for the Parent Mentor Program through Morrison, person with lived experience, and I'm a commissioner here. What am I grateful for? So many things. Today I'm going to say I'm grateful for my child's doctor. It was a good doctor's appointment this morning, and I was super nervous going into it, but I feel much better now. So grateful for doctors. Let's see. How about Yolanda?
Thank you. I'm Rolanda Garcia, and I'm the interim child welfare director. Nice to be here today. I think, did everyone go? Matt?
Gian and Matt.
Matt?
Hey everybody, good morning. My name is Matt Miller, owner of Miller's Barbecue. I'm also a pending commissioner as well. I'm waiting for approvals. Today I am thankful for strength. The last couple of weeks have been a little bit heavy with my team as one of my coworkers' dad or employee's dad did a self-suicide on Facebook this last week. And so being able to have the strength to support my team is what I'm thankful for today. Let's go Dean.
All right, everyone. Dean Salazar, he, him pronouns. A member of this commission, person with lots of lived experience. Different boards relating to youth and stuff like that. And the one thing I'm grateful for today, I was debating between two things actually, but I'm going to say the word agape actually, because in Greek there's three different words for love, and agape it is different from eros, which is, you can probably imagine what that means. But agape means where you care about someone's well-being regardless, and it's a very selfless thing, and very active, and that's sort of what we do. So I'm grateful for that and its impact on our work and foster youth in general. So thank you.
And I saw Judge Chico was able to join us, so welcome. We're just doing quick introductions, and the icebreaker is one thing that you're grateful for today.
Perfect. Sorry I was late. I'm Megan Jaco, and let's see, I've been on the commission. I'm coming to the end of my first term, but I'm applying to continue. One thing I'm grateful for today is family. I have spent a good weekend with my family this weekend, so that's resonating with me. Did everyone else go before I got here?
Oh,
I believe so.
we, Matt Crowell's here now.
Matt, can you hear us? He may not actually be.
Oh,
Yes,
yeah,
I can.
he's
Yes, I
just-
can hear you. I'm trying to
he's
take
just
myself off mute. Can you hear me?
We can hear you.
Okay. Hi, Matt Kroll. I've been on the council for almost a year now. I'm in law enforcement, and then one thing I'm grateful for is I'm getting the movement back in my arm. I had to have surgery, and I've been stationary for the last 2 months. And last 3 days I've been able to actually get movement back. So that's pretty awesome.
I see. Okay. And then we'll get ready to hand it over to Rolanda if she's ready. One quick update for everybody is we did have a meeting with the governor's office as we were preparing for our monthly commissioner meetings. And my understanding is there's a round of confirmations coming up in April. So Sarah and Matt, who's waiting for the legislature. My understanding is there's some confirmations coming up in April. We're hoping to get everybody in by April, but if that's not possible, there's another round of confirmations in June. So I don't have any further updates. I know names have been submitted to the governor, and we're hoping to get everybody confirmed in April. And Rolanda, are you ready?
You know what, Ellen, I sent you the PowerPoint in an appointment. Do you mind just pulling up the PowerPoint until Desiree joins? I think flipping the time confused the staff that were going to be here with me. If you don't mind doing that, I have my other. Do you see that, Ellen?
Ellen, can you hear us?
I appreciate
Yes,
your.
I can. I couldn't get myself off mute there. I
Okay.
can look for it and I can probably share it, but I'm on one screen today. So I'll have to take myself off. So that's what I'm going to do. And I'm going to look and because I'm bouncing between.
I'll prompt you when I want you to flip the screens, okay?
Okay.
Thank you so much. Multitasking is not my best skill, so appreciate your patience with me. I'll wait for Ellen to share her screen and then, oh, somebody's joining, so maybe they'll help. Jessica, Ellen was going to help, but are you on and ready? They're ready for me.
I'm uploading them right now and then I am ready.
Okay. You're off the hook, Ellen.
Thank you. This is good. Good news.
I'm glad we had a little room today. Okay, let me know, Jessica, when those are up. I'm also unfortunately on one screen today.
Okay, I'm just trying to get them in the appropriate view and then I will share. Sorry for the delay, everybody.
I unfortunately, but have to be in person at a meeting later today, and so that's why I had to go first. I should have paid attention that we were on the agenda later, so I do have to apologize about that. I'll start to talk about just a little bit of why we're doing this while Jessica pulls it up and starts to share. I think many of you may have joined this year. ODHS put together a community sort of roadshow. My own words, it was called Together We Plan Sessions. And those conversations were very thoughtful, candid, and deeply important, I think, to the organization. They wanted to make sure we're engaging with all the community around our budgets and how we actually build our budget internally. I think a lot of our partners may know some of this, and so if it's a repeat and you're all aware of it, I have to apologize in advance, or if you've seen this presentation, some of it is a little bit duplicative. This is specific to child welfare. One of the biggest takeaways we actually ended up with when we did those community engagements is that most of you, at least most of you, expressed that this needs to be an ongoing discussion and not a one-time thing. And so I do want to say that if you have your hand up or you have a question, I may not see it, please prompt me and or leave your questions till the end and I'm happy to answer them. So today is part of that continued commitment, and we appreciate that you're allowing us time on your agenda. Next slide. That's right. Sorry, Jessica. So we're going to do a brief overview of our budget process and share the reality of the limited resources we can expect this next biennium. So just to clarify, this biennium goes till the end of June of 27, and we just finished short session, and we came out of that with some minor actually implications for our budget. So what we're talking about today is the next biennium, which starts July 1 and of 27. So I just want to be clear about that. So, but we really start to plan all of that pretty soon. So today we're going to go over the timeline, what we end up doing as an organization and a program to get ready for that, which is in the fall and then early 2027 when we go to long session with the legislature. The majority of today's conversation is about prioritization. And we're not really asking you to choose. What we're asking is for your insight to make sure that we're on par and we're making the right decision for our program. For tribal nations, I want to just reaffirm that, formal government to government consultation continues through this process. And we will be leading, asking the Office of Tribal Affairs to take the lead in that. And we'll be presenting at a few of the tribal events that are coming up. Next slide. So before we turn to where things stand now, we want to reflect back on what we heard through the sessions. What we heard was important for child welfare is family safety and child protection are really our priority and the core work that we do in child welfare. Cultural and community specific services to protect cultural specific and community-based services are really important to our community and families. Economic and food security, economic stability and food security. And although those have indirect child welfare impact, they're really important because what we do know is economic stability on families prevent them from coming into child welfare. Workforce and capacity strain. How do we continue to really build up our workforce so they stay and we don't have such a high turnover? And then the impacts is how do we make sure that we don't impact one area to the sacrifice of the other? And then within all of this work, how do we make sure equity and the vision of keeping equity at the forefront is part of our work? So within, again, all of this, what's really critical is I think you've all heard us say that the vision for transformation is still guiding our work today and will continue to guide every decision we make along the way. Next slide. So our fiscal reality, really you all have heard that the state's going to be facing some real hard decision next biennium. It's a tight budget. There's no new general fund. And so we are going to have to really build our budget based on current expectations of program, and we will not be looking to move forward any requests that would increase our budget necessarily next biennium. Expenses rising at the same time, maintaining current services is becoming more expensive. You all know that most providers need cost of living increases in rates, etc. We have to fulfill our obligations, and you all also are aware that we have state and federal mandates, and those we have to make sure we're taking into consideration as we build up our budget. And then the demand for core services remains high. When you put these pieces together, it limits really how we prioritize our budget sometimes. And we have to make sure that we're fulfilling all these obligations. Next slide. So as I mentioned earlier, there are 3 phases to our budget building. The first one is the agency request budget, which we would refer to as ARB. This is when we're gathering input from programs, community members, service providers, partners, and tribes about what people need and what's happening on the ground. We also use, ongoing policy work and recommendations from work groups and advisory committees to shape our ARB. Child Welfare has chosen to attend a lot of these already existing committees to share our work and gather information. And so you're the second group we're attending to share our budget with. The second phase is the governor's recommended budget, GRB. So the governor then takes all the recommendations from the agencies and programs and then finalizes the budget based on the governor's priorities. And then the last piece of it is the legislative adopted budget. And that's what really the legislature reviews the governor's budget, makes the final decisions, and then lawmakers hold hearings and hear community testimony to make the final decision on what our budget is going to be. So really, we are moving through this process right now, and we are in the ARB process. Next, Jessica. So ODHS's role is really limited to ARB. After that, the governor and the legislature are responsible for crafting and approving our budget. During the legislative session, our role is to explain implementation, our impact, and then our operational considerations. We, as you all know, do not advocate for or against legislation unless it's directed by the governor's office. Community partners, providers, tribes, and advocacy organizations can speak for themselves and are encouraged to share their own perspective and positions directly with legislators. Clarifying this distinct helps ensure transparency about who's responsible for what during the process. 7. For the next slide. Okay. I think what we're going to do now is just talk about the difference between what we would be looking at during this ARB process. So a policy option package, which is what we refer to as a POP, and then a reduction option. So we're being asked to look at both right now. We're going to explain a little bit about those. And so next slide. So the policy option packages, really it's the governor's strategic priorities, and what it is, they must align with the governor's priorities, agency's mission and vision, and then leadership's guiding principles. And really what we do is we look for policies that are going to improve our practice and our work, which, as I mentioned earlier, is safety for families and children. And then we move those forward if they include a revenue and ask for legislative proposal to add funding. This year, child welfare is not moving any POPs forward. We are going to just keep working on implementing the work that we're doing currently. Next. So the governor's priorities have been very clear. It's economic development, and you can read the details on the slide. Executive orders like clean energy, aggressive immigration enforcement, housing, behavioral health, affordability, customer service and efficiency. And for child welfare, customer service still is about how we serve families, and then protecting Oregon values. Next. So child welfare is currently proposing one POP, but it will not be asking, I mentioned earlier, we're not going to do that. And really what I mean by that is we're not going to be asking for additional funding. What we're going to do is use some savings within our own program to fund the expansion of Focus. Some of you may know what Focus is because you may have experienced it in your own, if you've ever been a foster parent or adoptive parent or a guardian. So right now it's serving our RSN is a program that supports families, and it's called Response and Support Networks. And it has really proved to be very effective with families. And so right now it serves Multnomah, Washington, and Clackamas counties. And what we're looking to do is really expand it statewide. It has really proven to strengthen our capacity to prevent placement disruptions, stabilize families, and reduce high-cost placements. It's definitely had an impact on temp lodging. And then the funding would come from savings that we have internally in child welfare. So we're not going to be asking for any new money. If you have any thoughts about this or you've experienced this, let me know at the end. We'll come back and ask for your thoughts around it. So just so you know, also, this program has really impacted kids staying safely in home. 80% of the children that have experienced, or families that have experienced the support through RSN, have been able to keep their children safely at home. It maintains caregiver satisfaction, 83% or higher, and it has prevented, like I mentioned earlier, from placement moves. Currently, temporary lodging, when we have a child in a hotel, it's costing us between overtime, staff, supporting the youth in 24/7 in a hotel, about $133,000 a month. It's something we're really trying to address. And my hope is, as long as I'm in this seat, I'm hoping that in the next year or two that we actually reduce or eliminate temp lodging. And so we're hoping that through RSN, we will reduce the use of temp lodging and save money ultimately. Next slide. So most of you also know that whenever we build our budget, and for some of you who've been on this for longer, we also always are asked to identify a reduction of 10%. And this is because we anticipate budgets. It's likely that if our budget or revenue comes back lower than what the state is anticipating, we've already identified some areas that we want to use as our priority when we're thinking about reductions. And so it's important to emphasize that this is a planning requirement. It does not mean that a 10% reduction will occur. It's just an exercise. And so every potential biennium, we have to go through this so that we're ready in case our budget doesn't come into full fruition, and then we're ready and prepared to talk about what that might look like for us. Next slide. So for child welfare, I just thought I'd share with you, whenever we look at reductions, we always look at general fund versus federal fund. When we look at general fund, that's 100% state money. When we look at federal fund, it's money that the federal government matches with us. And so when we're looking at reductions, it's really critical that we look at the general fund areas, because those are the ones that would bring us the most reduction percentages. And so in order for us to really look at all the areas, these are the areas that child welfare funds mostly. As some of you know, it's adoption assistance, residential treatment, regular foster care payments, guardian services to families, family and safety services. Those are the contracts that we have locally to support families. Child and family supports, focus, what we just talked about, family first, independent living services, respite care, and then the others are other medical, personal care, addiction services, of course, staff positions, and then service and supply, really the funding we need to make sure our branches are operational. I will say that we are currently in this biennium holding back positions 180 days. Not all positions, CPS positions are an exception, but almost all vacancies right now are being held 180 days to create some savings for us this biennium. So that would be another area we would look at next biennium. Next. So the largest budget allocations are typically in these 5 areas that will have the most impact in terms of proposed reductions. Child welfare leadership considered previous community and tribal input, as well as our budget realities, and then developed this draft proposed list of reductions. The largest allocation category is resource family, adoption, and guardianship rates, but it's number 5 on this list because we prefer not to impact that if at all possible. We know that our resource families rely on the minimal support we provide for them. And honestly, we're trying to really expand our foster care model, and we don't think that this is a good strategy to impact. So the other thing that I want to be clear about, when we say a reduction of 10%, that's not across the board in every category. So we could take, for instance, 15% out of service and supplies, and then 7% out of services to families. Ultimately, it's the total budget that we have to come in line with. So it has to be a total of 10% across child welfare in this exercise. So when we list these areas, it's not a identical 10% across all of it. It could be more in some areas and less in others. I'm gonna just pause for a second to just ask if you have any input for us, any considerations. I think this is really our last slide. And I just want to see if you all, if this made sense, and if you all have any thoughts or ideas for us, or if you believe that we're looking at the right area. I don't know, I can't, there you all. Any thoughts or priorities, or, oh, I see a lot of hands up now that sorry, I couldn't see you before. Was so carried away with my little presentation. Alexis.
Hi, thank you so much for your time. I just wanted to ask, is there any possible savings I know that there has been a shift in telecommuting. I was wondering, like I went to the Human Services building in Salem and it's there's not really very many people there. And I wasn't sure if there could be budget savings in not having office buildings any longer for child welfare, maybe across the state, if that maybe is being considered.
It's a very good question. And so a lot of the facilities, Alexis, and anything that has to do with those kinds of budgets, they fall under shared services under a different. So today, my responsibility is the child welfare program. The reductions that I talked about happens across the entire agency. So that 10% exercise everyone has to do. So today I'm only speaking about child welfare. And it could be that we come back and the governor says, in the final budget, we're going to take less here and more here, and this is what we end up with. But off the bat, everyone has to do a 10% exercise. Does that make sense? Okay. All right, who's next?
I guess I'll go. So I have a couple questions though, and one statement. So first, of course, I think it should be obvious to everyone who knows me and our roles here that I am strongly against any cuts to services, et cetera, and I'd of course worry about any cuts to the frontline staff and stuff like that. Anyway, so that thing aside, my two questions are in regards to your guys' budget, and so these are two things that I'm curious if they could generate savings. One, if there are like a lot of positions that are in some ways redundant that could be consolidated. Like for example, I work in Portland politics, so like I know that like for example, every bureau had like and department has like a budget director or whatever, and that's not necessarily necessary for each of them. So like I'm talking about sort of similar positions to that. And then, or other administrative positions with similar redundancy. And then the other question is, would zero-based budgeting also help generate more savings without reducing, basically anyone's pay, obviously, because, I don't want that to result in people's, pay cuts or stuff like that, but ways to like contain costs while maintaining as little cuts to the meat, so to speak, as possible, because those are the two things that pop up to me as two potential strategies. But I get that you guys are in a tough position, so.
Yeah, so again, I think as an agency as a whole, we'll look at all of the things you mentioned, administrative cuts or anything like that to get a budget that's requested. As the child welfare director, I am looking at only my budget and the impacts of my budget. And so, like I said, this biennium, we have paused on hiring, which has really been approved to create some savings. And so we're not eliminating positions. We're just saying, if you hold off hiring for 180 days, then during that time, we'll create some savings until that position is hired. We've excluded some positions that we feel are critical, which is CPS, and then like all of our central office positions that do all of the policy design, there's no exception. So if anyone quits or moves on to a different job in central office that support the work, those we won't be able to fill for 180 days. So we're creating different ways to fund. I actually agree with you. Services to families is a very critical part of the work. We need families to be able to engage in services. We want to be able to return kids quickly. We want families, we want the courts to be able to have options as they're recommending services to families. And so that is not an area that we will definitely want to tap into unless we absolutely have to. A big chunk of our budget actually does go out to contracts and services. So at some point, if we're asked to cut that much, something might have to be impacted, but we'll make sure we preserve that the most.
Thank you.
Oh, you're welcome.
I actually do have a follow-up. I'll wait for others.
Sure.
Go for it.
Sure.
Judge Echo, you're next.
All right, I kind of echo what Deanne said about services to families being really important. This is an incredibly difficult exercise, and I appreciate your, attempt to prioritize these. Is there any, has there any work that's been done within the categories about how to triage like pre-jurisdictional services, or whether you're only going to continue funding services after the family's been taken into the jurisdiction of the court? Because I found that those over time have been really successful in avoiding the kids coming into care at all. And then with regard to positions, there are lots of different positions in your agency, and some of them are more crucial than others. I agree with CPS. It seems like we could do more to try and use safe resources that could supervise visitation and not document so much, just to be able to save money on those types of positions, if that's something that, I don't know if there's been any work to try and identify which positions would be less crucial so that we don't end up doing across-the-board cuts.
Yeah, thank you. I think we will continue to invest in front-end services because we do agree that keeping kids at home is the best way for families and for children. We do 100% still believe that our children do better with their families. And so as much as we can invest at the front end to reduce removal, we'll continue to do that. And yes, we will go through an exercise of identifying the most critical positions versus positions that we could pause on. And so we have done that exercise this biennium, so it'll be easier for us to do that. I mean, the reality is delivery, where our work is being done, has the most impact because they need those folks to do the work, right? And so we try to protect delivery the most before we actually hold any positions back. And so, because we know that we need to make sure families are continued to be engaged and kids are seeing their parent, like there's lots of work that we do that's critical to the core services that we do, that we will not be pausing on those positions. Jesse.
Yeah, you had 5 different areas, and I was looking over those areas, and from my perspective, from where I sit in the community working with child welfare, I'm a parent mentor, and I support people going through the reunification process. And I work alongside child welfare. And so when I seen those 5 lists or 5 areas, I thought 2 and 5 were the most critical out of the group of areas to not touch, because of the impact on the children and the family unit. So that's where I come in from my perspective. And yeah, if I was to make a suggestion, not to touch 2 and 5.
Thank you, Jesse. You were asking our team to take notes today, and at the end, when we're going through these exercises, we'll definitely take all your comments into consideration. Thank you, Jesse. Definitely. And I do believe that your program is one of my favorites too, though.
Thank you so much.
Yeah. Dion? Is that how you pronounce your name?
Yeah, Dion, Diane. Look, my mother, my godmother combined it, so like it's no big deal. Everyone can relax.
Okay.
So it's not a cultural thing. So anyway, so actually this is in regards to this is in regards to like accountability and stuff like that as well, because I serve the Portland Children's Living and I've lived experience. So like I've seen some of these programs, and just so you know, your program is great, et cetera, et cetera. most likely. I haven't seen it, but I believe in you, Jesse. So, but however, that aside, I do know that there are a lot of groups and that have been, even news articles lately about uh, our partners and collaborators not living up to their standards and living up to expectations, which means that they are essentially being a net negative on the efficacy of service delivery to our vulnerable youth. And to me, that is an equity issue because it means that the people who need the services are not being provided the best quality services that we can, and that it's resulting in them, in people basically making sort of gaming the system in a way that harms our most vulnerable communities. And so the question I have, and again, this is the follow-up question from earlier, is there anything that child welfare is looking at and anything in their portfolio they're looking at to look of how to look into those groups and audit them so that they can figure out what groups are actually, able to deliver on the promises and on what their work is, so that we know that the youth are getting the most effective services possible for a cost, for a good cost effectiveness.
Yeah. I'm going to assume you're talking about contracted providers
Yes.
that serve youth. I'm just trying to understand your question.
Yeah, sorry, it's contracts, service providers.
Yeah,
stuff like
we're
that.
actually putting in place, I mean, I'm sure you all heard about we're going through a transformation of our organization as well. We're putting in place some real oversight around our contracts and how we actually look at services being provided based on the contract statement of work and expectations. And so we had an audit, and we have a whole team that's actually implementing many of the recommendations. And so our hope is that we become, as an organization, more accountable to what it is that we're actually investing in and the services that we're getting. And so I'm hoping that will also transpire over the next year or so, because I think there's a lot of attention around that.
Thank you, Rolando. That's a good step, as it is both helpful in regards to costs as well and cost effectiveness, and making sure that the people who need it are getting their services, and that is my top priority. And of course, you already mentioned the attention, so you already know some of the news stories have come. So thank you, Rolando.
Of course. Jesse, did you have your hand up, or you're fine? Okay.
Thank you, though.
I so appreciate the engagement, actually. We've done this is only my second presentation, and I love the feedback and input that you all gave. Any other questions?
Roland, I have a comment. So, take this with a grain of salt because I represent parents and children. But I see, from my opinion, I think we overfile on cases. I think there's a lot of cases that I hear from the AG's office. Hey, it's preponderance, right? So, we don't need a lot of evidence. It's just, one person's version versus the other person. And so we get a lot of cases that are just kind of he said, she said, the in-home plan, not really a safety threat. The allegation is you need to get custody, right? Like you fail to have custody, these type of cases. And so, I've always been a proponent of looking at our law and potentially changing the standard to clear and convincing for all cases, because I think, if we're removing children from somebody, that's a big deal. Like that's, to me, that's worse than going to prison. And so I know that that's not something that's likely going to happen in, any short-term future, but in looking at cost savings, is there any idea of evaluating the work that we already do in terms of how we evaluate safety? And just, I guess you're probably constantly looking at that. It's just the feeling is like, in Lane County, we've been told that they no longer do voluntary cases. And so we're not really able to do any of the services before removal. And oftentimes we're told, even if it's a small thing, that the only way that the agency can get involved is to call the child abuse hotline. Makes sense on limited resources, but I think, what that means is we have a lot of these cases that have no chance of ever getting through jurisdiction, but we, string them along for 3 to 4 months, when we probably deal with that stuff outside of court. And so that's more of a comment. It's just, I think that when we're looking at reductions, I think that we could also be more efficient with the stuff that we're doing.
So Casey, that is a really deep conversation. Like, I don't know that I can answer that in a very quick way, but I'd be happy to come back and spend some time with my deputy who's taking the lead on some of this to really get into it. The reason for our pause on voluntary cases, Casey, is because we needed to really strengthen our safety assessment at the front end and really make sure that when we were making decisions to keep kids at home on a voluntary basis, that the caseworkers were doing a very tight safety assessment on the family. I think we saw some work through our audits that that made us just want to pause on that a little bit, that if you have a safety threat and you're worried about the family, then you need to take an action. And I think that that's why we did that. It's so when you're hearing about that, it's not because we may not go back there. It's for, as we, when I took this position, we really needed to hone in on our safety, and we needed to really train our staff on how they assess safety in the home and what services the families need for us to be able to keep the families. So I agree with you at the same time that we should not be removing kids unless it's an absolute necessity. So I do agree with you on that. But we have to get really clear around what are our safety plans? What are we putting in place to make sure kids are safe? And so we're working through that. We've got a bunch of like trainings, and consultants are working with districts on to really hone in on this work. So, but it's a probably much deeper conversation. And if this group is interested in that, in the future, I'm happy to come back and talk about it. Judge?
So I don't mean to monopolize your time, but I was looking at the respite being number 3. Do we have work going on to have experts try and figure out how we can use targeted respite to limit hoteling and all of those dollars that go out for that all the time? Those really difficult kids, we don't want to not have a place for them to go, but it seems like if we used respite better, we would be able to avoid some of those blowouts that end up in having them in hotels.
Yeah, I don't know that we would eliminate the respite program. It would be just a reduction. It's not the first on our list, as you could tell. It's just one of the programs. We just finally implemented our respite program not too long ago, and we don't want to go through a process of not having a respite program. We agree with you, respite is really important. But I think when looking at all of our budget, as you all have identified different areas, it's really a struggle because most of our areas are really important for families and children. So, my hope is we don't have to go through that and we'll have enough money to fund our services. But if we should have to go through that, I think we'll have to tap into some of these unfortunate areas.
That's been kind of targeted in the legislature for years. Have they made any progress on trying to figure out how to deal with that? Do they have experts working on it?
No. Like, I think that that's an area that we will continue to advocate for in terms of the need to have respite. We believe that we can retain resource parents if they have a venue to have some relief. And in our effort to really expand our foster care system to maybe at some point we should come back and talk about the federal changes that are coming down around a home for every child, which will change our CFSR reviews. And so those might be good topics, Donna, in the future. And so I think that would be something to share with you, but we're looking to expand our foster care system, not reduce it. And respite will be a huge part of that.
That's great. Thank you.
Yeah, of course.
Rolanda, would you like me to send the slides out to everyone? Would that be okay?
Sure.
If I share them?
Sure. Yes.
All right. I'll do that.
Well, thank you for your time. I thought it was only on for half an hour, but what time is it? It's getting a little... I took up most of your meeting. I apologize about that.
Well, thank you so much, Rolanda. We appreciate your time and appreciate your updates.
Thank you, everyone. Have a good day.
Sorry, I just had a screen open and I can't get it off. Okay. So our next is going to be Rachel with the governor's office, but she doesn't look like she's here quite yet. So if nobody's opposed to it, why don't we just jump forward a little bit and go to the members' comments, concerns, or topics to address? And so if any members or Ellen, if you have any updates, please jump in now.
Yeah, thank you. I did want to give my update and let everyone know, and Alexis is here today, but I will be taking the foster care ombuds position as Alexis leaves that position and super excited. And now I can finally, as I've passed all my background checks, I can finally let people know. So anyway, I'm going to miss you all. And Donna and I will be discussing what happens here for the commission. But thank you.
And as part of that, we, I know we don't have any clarity on that, and Donna, I don't think you have clarity on that yet, but we did just hear about a hiring freeze for 180 days, so we're not sure how that affects this position. I know that Ellen and Donna are going to continue to meet on this. I'll reach out to them and be in contact with them, and so we'll look what that looks like. Obviously, at some point we'll get this position filled, but I don't yet know if the hiring freeze is affecting this. I would, off the top of my head, assume it probably is, but we'll work through that as we get there. Ellen, congratulations. I'm so glad that you're staying in the foster care world, though.
Woo!
Any other commissioners have any updates? We're kind of stalling time here because we've got 6 minutes until Rachel's on.
Did we already approve the minutes?
We don't have quorum.
Okay, all right.
Not really. Oh, Ellen, you had something to say?
But for a moment, we did have quorum. There was a moment here where we did, but we may have lost it. Did we?
I don't have that. Pamela or
We don't
Malik
have
have been
7.
here.
Oh, yeah. Okay. Pamela and Malik are both gone.
And we can only afford to lose one. So Judge Jacot is getting re-nominated by the Supreme Court. So we expect to have her on for another term if she had let us know. And then 3 names have been submitted to the governor's office. I think that they're in support of those 3 names. So we should see those coming on as well. Later on, just to give everybody kind of an expectation, we touched on this last meeting, but doing our biannual report is one of our to-dos this year. If there's people interested in doing that, we'll work with, I guess it won't be Ellen, but it'll be the new staff person. And really we're updating the governor, on the work that we've been doing over the last 2 years since we last did our biannual report. So updates on what we've been doing, maybe a little bit of look ahead on, what our goals are. The other thing that's in the works, which I don't know what's going to happen with this, Ellen, now, is we were going to be planning for an in-person retreat probably around June, July, or August. With Ellen stepping away, we may need some additional support to make that happen since we've got to reserve rooms and things like that. So we'll continue to work, but we've got a couple of big picture things on our plate for this upcoming year. And if people would want to be involved with either of those, especially writing the biannual report, last time I think what we did was have 2 or 3 people kind of work with Ellen on putting together the report, and then we shared it with the wider commission and allowed them to make feedback and edits. And then once we had a finalized product, we went ahead and submitted it.
Wait, so are we stalling until the next agenda item or until we have to have an hour meeting to?
What? No, we're waiting on Rachel, Dean. So Rachel's gonna come and talk about the 2026 legislative session. She's scheduled to be here in 3 minutes, so I would expect her to be hopping on in any moment.
Oh yeah, good, yeah.
So I'll actually just open this up for public comment as well. So if anybody who's not a commissioner wants to jump in, have anything to share, maybe Sarah, if you wanted to kind of introduce yourself to the wider group a little bit more, love to hear from you.
Yeah, sure. I kind of mentioned I'm a pediatrician. I work for Clackamas County Health Department. for the past 10 years now, actually, last month. Yeah. And yeah, I mean, it was interesting to hear that presentation about, the budget and kind of the priorities and hear all of your feedback. I didn't know if it was appropriate for me as a non-member to comment at all. But definitely agree with, obviously the focus on preserving services to families. It was interesting to hear what you had to say, Casey, about seeing cases that are referred through law enforcement that are not ones you think maybe merit removal of the child from the home, for example, and maybe focusing on that. I have a little different perspective in the medical field. I feel like I often see kids that I'm concerned sometimes about safety and have, trouble on occasion getting DHS to involve. But I wholeheartedly agree that focusing on preventive services would be, much more beneficial if those were offered to families more. It's sad to see DHS viewed as such a punitive thing here in Oregon. I know, and I've talked to physicians in other states where they've said DHS is sometimes viewed more as just, they offer support and resources to families. So it's not always just removal of the child, or they don't remove the child and then they're just out of the picture. That, like she said, is a whole bigger conversation though. So anyway, I don't know how much more I should share, but and happy to share more about myself as well if people are interested. But yeah, anyway, just a few thoughts.
Thank you, Sarah.
I'm interested, Sarah, if that counts.
Oh, sure. Yeah. What would you like to know? I'm not sure exactly what else to share. I guess I should share actually one relevant thing is that I do also have lived experience. I was a foster child in Multnomah County through various points in my childhood, but the longest stretch here in Oregon was from 12 to 16, I believe. So I do have that background as well. Obviously, it was a while ago, but that also informs my perspective. Working in Clackamas County Health Department, of course, I see a very high needs population, socioeconomically speaking. Many of my children are either in foster care or the families have, histories of DHS involvement, as well as many in kinship care that don't have any formal DHS involvement, but, obviously, also, face many of the similar struggles. And I also see a population of children that are in OYA custody, that are in residential behavioral treatment. So another group that I interact with. So I do interact a lot with those families and, have my own background in it as well. Yeah, and happy to share anything else that you guys want to know. You might have heard my dog snoring loudly, so I apologize for that. This is Momo. So when I'm not muted, you'll probably hear him as well as see him, but I hope that's okay.
Thank you for your commitment to that population.
Yeah,
Thank you.
I really
for your
enjoy
work.
working with them. Yeah, I mean, it's, like I said, my own background, and, I think it's nice to have that perspective of like hope that, the patients I see, even if they're in a difficult place, that doesn't define their life. It didn't define my life. But also being realistic about, the challenges that does place, and that many children in foster care will not be able to, even graduate high school in some cases, let alone go to college, and just want to do everything I can to, both maximize their physical health, their mental health, their social outcomes. So yeah, which is why I wanted to join this group. So thank you for having me.
I think it's really wonderful too, because we have it's such a good group that's applied to come on, and I know that Matt, who had to leave earlier, the other Matt, he is also very interested in opportunities for foster youth to be entrepreneurs, start their own businesses, make sure they go to school. He's done a lot of work around education and serves on the education committee. So you have a lot in common there as well. So that's exciting.
That's great. I
Ellen,
look
do you have
forward to hopefully joining, formally and being able to participate more.
Ellen, do you have any update from Rachel?
I do not. I don't see her. I've been looking to see if she is joining. I can turn off my camera and check emails though. Generally, she's would be here by now. So she did say 12:30 though. So let me check.
Casey, I could share, if we're just going to wait here a few minutes, about Senate Bill 1533. It's a bill that passed House and Senate. I got busy this morning, forgot to look to see if the governor has signed it yet. So I'm not 100% sure. Alexis is shaking her head unless she's not referring to me. Maybe the bill is not yet signed, but pretty
Not signed yet.
Okay,
Michelle
thank
thinks
you.
it's going to be today, though.
Okay, thank you, Alexis. So I've drafted the rules to make the changes. And what was passed was several things that didn't quite make it last session. So it will be in the statute that when siblings are the contact between siblings is limited or prohibited, that has to be made in by a judge and have basically findings of fact in the court court report, not the court report. That's what we do. The court order. It will now be statutory that all children in care have a right to an attorney to be appointed by them. And I am unclear. I think that's happening already, like the vast majority of time. I don't know about across the board, but it's now going to be a statutory right to have an attorney. The other one that I think is significant, but you all in the thick of it may say, oh no, that happens all the time anyway. But there will be a requirement on law enforcement when a child in care, that definition of child in care is being interviewed by law enforcement, whether they are the subject of the investigation, a victim of the investigation, or a witness. Just in child welfare, they have a right to have their attorney present during that investigation, or another individual, I think, appointed by the court or someone. It sounded like maybe a CASA. Like it doesn't say CASA, but that's kind of the language. And sorry, Casey.
I was just going to ask, does the child have to invoke their right to the attorney, or they will not be interviewed without their attorney?
Let me not try to answer that based on my brain, and I'm just going to tell you. How about if I just tell you? Okay, I'll just tell you, Casey, it doesn't say specifically either way. Just that they have a right to unimpeded contact with their attorney. They have a right to have an attorney appointed, and they have a right to have that attorney with them during the interview. So this came up in the RAC actually when we kind of discussed it, and an attorney for children spoke up and said, "But who invokes that right?" Because the department is then has to either temporary custody or guardianship of the child, and we should be invoking that right on their behalf. This is what Lisa was saying, and attorneys have to be notified. Thank you, Alexis. Man, she's on it. I should have had her talk about this. She's going to put it in all the language in the chat. I appreciate that. So I think those are really good questions that I wish were more clarified in the statute. What we're going to talk about in in child welfare's procedure is we're going to encourage caseworkers. We don't appoint, obviously DHS doesn't appoint attorneys, and DHS doesn't get to oversee what law enforcement does. But we can, for instance, call Alexis or soon to be Ellen and say, hey, this child we have in care was interviewed by law enforcement, or encouraged depending on the age of the child. We also can call their attorney and say, hey, they were interviewed and you weren't notified. That's what we're going to be. That's at least what I can think of. And I'm happy for any other thoughts on the matter that we can control from the child welfare and from the department standpoint. That we should be saying to, and if we're there, if they come to law enforcement goes to school and child welfare is also there, that we should be saying, hey, they have the right to their child, or the right to their child, right to their attorney there. So
are there plans to train law enforcement so they know about this? Because in my experience, it takes a while to trickle down when there's law changes.
Also a really great question. And I had asked Michelle, our legislative coordinator, there was no one that I saw present at any of the hearings that were representing law enforcement. And I know there's obviously there's just so many different, city, county, like, within the Portland metro area, how many different, jurisdictions are there? So I asked that question, and she indicated that they're, the sort of the lobbyist for that law enforcement was made aware. So I don't know the answer to your question about training for law enforcement, but
And Matt,
so I'm
Matt
trying
is
to
on the
figure out
line.
what we can do. Sorry, Casey.
I was to say Matt is on the line. Maybe he can tell
Oh,
us how he's informed.
All right. So it's my understanding that when interviewing anyone under the age of 18, the guardian has to allow or give the permission for law enforcement to whether revoke or invoke rights when it comes to attorneys, or just allow law enforcement to question anyone under the age of 18. So in the case of someone being in the care of the state, I'm guessing their caseworker would have to be the one that allows law enforcement to interview that child. And then the caseworker would be the one that like recommends, like allows the attorney to be present or not be present. That's
and
my
that's actually
experience
really
with.
helpful. That's a really helpful because we can write that and train workers that way to say when you're giving permission, when law enforcement is reaching out to you, you need to contact their child's attorney. So immediately. So that's actually thank you, Matt. That's actually really good. We
So
can write that way.
with the issue I don't know how it is in the very urban areas with DHS, but out here in the rural areas, sometimes the DHS workers have overlapping responsibilities. Most children out here, when they go into care, get a caseworker, and that's their caseworker until something happens. But sometimes one of the intake people will fill in for a caseworker, and that's where it can be kind of an issue when DHS is involved. But my experience, that's the route we take. Whoever is the guardian of the child is the one who is responsible for the legal process and allowing law enforcement to intervene or interact. So that's my opinion. That's what I've experienced.
So I
And
assume
then
Matt, would that
go
be the
ahead.
same thing? Like, so if a child was on an in-home plan, but technically the state had jurisdiction, would you know to go talk to the caseworker, or would you just assume that the child's in home so that, they're not in foster care?
You mean if there's an open case against the parent, but they're in home and there's visits, like DHS is involved, they're just not directly involved, you mean?
Yeah, so like you have a child, he sets a fire, right? But he's
Yep.
he's residing in home with mom. You go to
Mm-hmm.
talk to him, you're not notified up front. Like there's nothing flagging that he's a DHS kid, right?
Correct. And sometimes we don't know, but in that case, we talk to the parent, and if the parent doesn't notify us that there's DHS is involved in whatever situation they got going on, then we just don't know, and then we'll have to deal with that at suppression hearing, because that will happen inevitably. But as far as training goes, we typically get biannual case law updates or just legal updates as far as new legislation when it comes to search and seizure and interviewing juveniles. But,
Thanks, Matt.
Yeah. Yep.
Rachel's on the line, so we'll go ahead and transition back over to Rachel, and she'll give us an update on the 2026 legislative session. Rachel, we did just get an update on SB 1533. And if you couldn't pick up the gist, we were just talking about the section that's posted in the chat that children have a right to an attorney present. And our conversation was regarding whether the child had to invoke that right, what that training looked like to law enforcement. So we were just kind of stalling some time. So welcome.
I don't think that's stalling. I think that's really important details to make sure it's really going to make sure that the legislation's meaningful. So I think I appreciated coming in, and Donna, thank you for leading that discussion for DHS to ensure that we really are making the most of that legislation. So in action, it's meaningful. So glad to be here. All right, where to start? I'll just acknowledge it was a really busy short session, and a lot was done. And it was interesting because, short session is not supposed to be a time when you're taking on real big, new, huge policy areas, right? It's supposed to be cleaning up, and if there's critical priorities while you're waiting for dealing with the really long, complicated policies, you work on that in the interim and you prepare for long session. And part of what we were navigating, for Health and Human Services, our number one priority going into short session was we need to make sure that we are clear on what budget and money asks we now have because of because of changing federal environment and changing, budget needs then to ensure that we could maintain social services. So I'm pleased to share that in the end, we were able to advance and secure funding needed to maintain critical services for Health and Human Services. We had to still take a lot of cuts, but how we took the cuts were in some staffing and administrative efficiencies. There were some delays of certain programs, but in terms of there was kind of going into session, I think a real fear about, goodness, are we going to need to make more cuts for the programs right now? Because there was also a cuts discussion. And ultimately what you saw was the forecast turned out to be not as dire for immediately what we needed to do. And the legislature did a disconnect in the federal tax code, which is estimating to bring in more revenue. So part of that messaging that the legislature looked at was how do we help to make sure that we can find the dollars that we need to maintain the services that we need to provide, because there wasn't an appetite to cut human services or health services in this legislative cycle for short session. That's what we saw. What we also saw, I'm speaking from the frame, I just want to note, of Health and Human Services lens as well. As you know, there were also bigger discussions as well in the legislature about transportation, et cetera. I won't opine on any of that. I'm going to give you the landscape from the areas that we know. I would note we also were really looking at childcare services as well, and making sure that we could maintain budget for childcare supports. There's some policy changes that came about. 4157 was a bill that really looked at how are we improving what DHS does and how the TANF program works and how are we serving our TANF population and families and ensuring access to childcare and coordinating better with the Department of Early Learning and Childcare. The DELC program, many times the program that we are using for families that need childcare is employment-related daycare, but there might be other programs that are better options, and we need to be more nimble and think more on how that coordination works. That's an example of the type of policy choice that you saw being proposed. Let's make sure we're in tight budget times, making better connections, making sure that we don't just say these families only should get this type of service for childcare. Let's make sure that we look at what options are going to best support families and focus on that and that frame of thinking. So that's part of what you saw in some of those policies. I'm pleased to share that, the governor went into this having 3 priorities in terms of policy bills. The first priority was in creating more affordable housing options, and specifically the governor had a bill that was making sure that we could speed up affordable housing development for seniors, and making sure that we could have manufactured home communities, allowing cities to designate land for these 55 plus manufactured housing communities. Really, again, in terms of the in the concept of we need to make sure we have more housing to help ensure that we are meeting the needs in our communities, and how do we help to make that easier, and how do we help to prioritize the changing housing needs of our older adults as well. The governor also, second bill that she worked on was really looking at credentialing and administrative burden, making sure that we could have different supervision pathways for behavioral health providers. This was a bill that was advanced by the Behavioral Health Talent Council that First Lady Amy Kotek Wilson chaired. That bill was successful at passage. And then finally, the third area that the governor had as her own bill was a prosperity roadmap package, where this was a bill that was really looking at how we do fast track permitting pathways for major investments for growing jobs, and making sure that we were really targeting kind of investment and economic growth. And that was part of the framing of that bill as well. So those were the three major bills that the governor had. And then there were other bills that came about that were really complementary. There's a bill that's really looking at how we're looking at chronic absenteeism. There was an expansion for thinking about delivering free books for kids, the Dolly Parton's Imagination Library, making sure that that program continues to grow and be successful at ensuring kids have access to books. There was sorry, just going through my list here. The other kind of general area that you saw was around immigration. There was a series of bills that were really looking at improving immigrant and refugee policy guidance, looking at, I would say, in the federal response category, strengthening protections for anti-discrimination protections, looking at ongoing investments for access to health care. There was funding that went to look at Planned Parenthood, for example, the legislature looked at. There was promoting of renewable energy, safeguarding public lands, kind of a whole suite of kind of federal response theme that you saw the legislature take on as well. In the human services areas, you already spoke to the Foster Youth Bill of Rights, which was 1533. You also saw 1532 in SB 1532 was the specific bill that was the Senate Human Services Committee's omnibus bill. And so as an omnibus bill, they tend to take on areas that are cleanup areas across the areas that relate to DHS. So you saw some specific changes that related to a long-term care regulatory oversight bill that passed last year, where we needed an additional timeline and extension for implementation for long-term care oversight. You also saw some changes for developmental disabilities on one of the some cleanup and a rate change for that program to make sure that we were really incenting the right type of care. And then in as it relates to child caring agencies and child welfare, there ended up being two provisions in SB 1532 related to out-of-state treatment access. One was specific to the Indian Child Welfare Act, and the basic, the simplest way to put it is that the state law is more restrictive from federal Indian Child Welfare Act, and that meant that we were not complying if there was a child that was a member of a tribe and they needed culturally appropriate, medically responsive treatment for their needs. And if they were in child welfare, the statute was currently read that you couldn't seek that out-of-state care. And SB 1532, and there was a complementary bill that had the same language, HB 4058, but SB 1532 was the one that ended up passing, but we had language both on the House and the state side and the Senate side. The tribes worked to provide language and to make sure that the language really worked to comply with Federal Indian Child Welfare Act law.
We did work with, there was a coalition that worked on that as well. The judges were involved as well because we wanted to make sure that there was communication and notifications that were also being followed, and so making sure that we got to language that really worked with that aligned with what the judges were seeking, but also that complied with the Indian Child Welfare Act was kind of part of what you saw during those policy discussions in the middle of session, and that was a high priority provision that did pass. So that was ensures access for kids. If a tribe requests, for example, we have 7 nations, tribal nations that have a really robust healing lodge up in Washington state that many times members of the tribe would like their members to be able to go provide services at. And so that now is an accessible and appropriate setting for being able to provide treatment, for example, with all sorts of conditions. I just want to note there's still a process. And then the second area that SB 1532 looked at for out-of-state treatment access was specific to eating disorders. And so stating that if there was an eating disorder need, that would, for medically appropriate treatment, that would be an allowable place for child welfare to provide those settings. I will note, just for sake of clarity and just being clear, we think having kind of those narrow exceptions is appropriate, especially when we're talking not about placement of a child, but for medically appropriate treatment access. And there were many times questions to say, DHS better not break the law, anymore. And we wanted to made clear as an executive branch. And I say executive branch because this is really about service provision that's medical, that also is led through our Oregon Health Authority. We made clear that there are going to be times, and part of what we do think is important to recognize is that if you're a child, just like my child who has private insurance, or if you're a kid who has the Oregon Health Plan and you needed access to medically necessary treatment, and that wasn't available in the state, there are ways and mechanisms to be able to get access to appropriate out-of-state medical treatment that many times that is required by federal law, for federal Medicaid law, to ensure that we're giving access to that treatment for those kids. And there may be situations that still arise where medically appropriate treatment might not be available in the state, and we'd have to consider those on a case-by-case basis. What actions would child welfare do if those kids were not able to receive that care out of state? And we couldn't speak to, not all those circumstances might just be for an eating disorder, but as the Medicaid medical director noted, many times we see kids have multiple diagnoses and complex needs, and we don't know exactly what all of those clinical diagnoses are going to be, we're hesitant to legislate clinical cases, but making sure that we are doing what we can and that we're able to maintain access to treatment is a priority. And so I just want to acknowledge all that. I'm just talking and I'm looking at the clock going, oh my gosh, it's 12:56. So sorry for that. But I think those were two really important discussions that we had. I would also just note that, and this was related to maybe when Donna was speaking earlier on the House side, there was a bill that did not advance out of the House, but made progress and had some good discussions, which were really looking, that was HB 4059 that Representative Hartman led with the work group that was really looking at the scope of jurisdiction. It aligned with the work group report that had come out the year before, HB 4086. There were some really robust discussions, and I think good discussions that came from that work group to really understand when what is the role and when should we have child abuse investigations and what's the role of child welfare versus law enforcement. So very much related to those discussions that you started with earlier today, Donna. And I think just acknowledging that that discussion continued. I think you will also see that behavioral health providers, raised and said, we think we need to have some ongoing discussions and are seeking a work group, a legislative work group, to continue to have discussions about the child caring agency regulatory environment. How do we both maintain child safety? How do we ensure we have clear regulations? And how do we make sure we have a workforce and that we're able to provide care in the workforce and that we have all perspectives being shown and heard. I think you saw some of those types of dialogues and discussions as well this session. I want to be clear, the executive branch was clear going into short session that we were not advancing a bill in short session on those areas. Our perspective going in was these are robust discussions. These are complex. We think that the ICWA provision is good to go, but some of these broader, more difficult discussions, we do think we need to have ongoing discussions. And we encourage that, but we did not have a short session policy bill that we were advancing at that time. I'm looking at the clock, so I do want to make sure I open it up for any other feedback or discussion, and go to you. Yeah, Dion.
Yeah, I'll keep it quick. So one bill that does concern me from a former foster youth perspective and someone who's focused on the cost of living at the moment and the cost of living adjustments for foster parents, stuff like that, is the bill that that the governor pushed and that passed, to my knowledge, that gave extra tax breaks for data centers, because that makes me worry about the increased energy costs and how that could gobble up any increases to the compensation for foster parents and stuff like that in a way that results in them being worse off than before.
Thanks, Dion. I think you're just
And of course,
noting focusing on
also
affordability. Yeah, focusing on affordability. How do we look at the big picture? How do we look at those trade-offs? I appreciate you sharing that input. Yeah, Judge Chaco, I see your hand.
Yeah, I really appreciate the narrowly tailored exceptions to the out-of-state travel. I mean, that reflects a lot of good thought into it, and I know there are real scarcity in local programs for those things.
Yeah, thank you for that feedback. And then my understanding is, I think you all had a discussion maybe before I came on about kind of the future forward next steps, like of policy, legislative concepts, and budget development. So now is the time. We're kind of coming out of short session. We're now launching our budget process for the long session. What are those ongoing policy discussions? Are there any legislative concepts that the committee wants to ensure that the commission wants to ensure you're advising to the governor to take on as next steps? This is really that time. I want to make sure that we're hearing, we're grounded in the process. You're hearing a little bit of what happened during short session. I welcome ongoing discussions with all of you as we think about kind of where might we need to go from here as we plan for the next session. So I do want to make sure that I'm just sharing that, and I'm happy to come back for any further discussions.
Okay. Thank you, Rachel. We appreciate you coming and giving us that update. All right, so we went a little out of order today. We already did the member concerns topics to address in the public comment. But before we adjourn, does anybody else have anything else to raise today? Okay, then we'll see everybody next month at the next commission meeting in April. So we'll officially adjourn at 1:01 p.m. And thank you, everybody. Hope you have a wonderful day.
Congratulations.